New York State has released figures on the number of people signing up for low-cost health insurance over the past week, part of the Affordable Care Act. The state's official health plan marketplace announced that over 40,000 New Yorkers have signed up for a health care plan so far. That's more than any other state. And the agency's customer service center says operators have provided help to more than 26,000 callers.
And the reason so many people were calling in, they were getting error messages or dealing with technical glitches. But experts say all is not lost. The insurance industry, along with some technology companies with experience in rolling out computer programs for millions of consumers, say there's still plenty of time to fix the problems before millions of uninsured Americans are required to begin paying for coverage on January 1st.
Well, despite those glitches, many more Americans are expected to have health insurance at the start of the new year, and many hospitals expect to see a surge in patients. So how will those hospitals handle the expected influx of new cases? And what will that mean for the bottom lines and the stock prices of the big for-profit hospital chains? Bertha Coombs has our report.
For hospitals, having more patients insured under the Affordable Care Act could be a game changer, especially for those with major emergency department operations, like Universal Health's George Washington University Hospital.
The industry in acute care runs between 12 and 20% bad debt. As you know, people that present themselves in the emergency room must be treated. Many of these people have no coverage.
Universal Health CEO Alan Miller expects new coverage rules will provide an even bigger positive for his company's behavioral health facilities, like this one in Ambler, Pennsylvania.
The individual policies and the small business policies did not have to have mental coverage. Now they have to have mental coverage as of January 1st, 14.
That could make a big difference for the families of young people with mental health issues.
Very often the symptoms show up in youngsters. And if you have an ability to pay or to be treated when you are young, teenagers, etc., young adults, it's very meaningful in terms of their ultimate cure.
But the Affordable Care Act also imposes tougher reimbursement rules for hospitals, and the sequester has already resulted in some payment cuts. Still, analysts say millions of newly insured patients should help offset those pressures.
We think there's about $3.5 billion of incremental revenue opportunity through the healthcare reform that should benefit the sector. When you take that revenue and you offset it against some of the Medicare cuts and other things that come down the line, you get a very beneficial margin bump in the industry's profitability.
Hospitals have seen patient volumes fall as unemployment has remained high the last 5 years. At the same time, uncompensated care has risen 8% annually, according to the American Hospital Association. Even low reimbursement rates will help.
You have to see patients come instead of being no-pay patients who maybe pay 8 cents on the dollar at best, become full-pay patients even at very low Medicaid rates.
That's why this fall hospitals are being proactive about helping their uninsured patients enrolled and making sure they stay covered.
People look to us for help and education about the healthcare system. They have for forever.
While he's optimistic, Alan Miller is in no rush to add staff ahead of 2014. Next year, he says, will be a time to watch and learn just how the newly insured respond to being covered under Obamacare. Bertha Coombs, Nightly Business Report, Ambler, Pennsylvania.